April is Autism Acceptance Month, and tonight we're shining a light on the challenges families have faced when it comes to diagnosing autism at a young age. News 8's Allie Peters is taking a look now at how health experts say care has changed during this pandemic.
Diagnosing kids with autism is something many health experts would say has always been an issue. But with things mostly virtual these days, early intervention has become increasingly hard, especially for some communities. For parents who have a child with autism, early intervention is crucial to helping them get the services they need. But like many things, the pandemic has impacted how families receive care.
But it then becomes very much more difficult if you're not able to do those assessments in person. Now you have to do them using telehealth, and there's not that in-person ability to actually look at the child's behavior and further diagnose them accurately.
Less families visiting their primary care doctors also having an impact.
Primary care visits weren't happening. People weren't taking their children in for vaccination, for routine visits, so that the suspicion of autism and the referral for diagnosis was not efficient.
And when assessments for autism did happen, they were happening online, raising concerns for families without access to technology.
Last summer, there were parents that I talked to of kids that were 5, 6. They didn't even bother getting the kids on because they didn't know how to use the technology.
She says the pandemic has shined a light on structural inequities and lack of access for African Americans and Latino families.
A lot of our families don't have that access to that technology. Now they have smartphones, right? But if you're not a clinician and you're not a teacher, parents are going to need support to be able to use these tools. We found this at the very beginning of the pandemic. A lot of our EI children were left way behind.
Dr. Hyman did tell me that one positive of the pandemic is that they've really been able to jumpstart their investigation into telehealth and early identification and treatment. In Rochester, Allie Peters, News 8.
Allie, thank you. According to the CDC, 1 in 54 children in the U.S. has autism. In the 1980s, that number was 4 in 10,000.